to the Eastern Cape now, where a data center is being used to track and stop the spread of the novel coronavirus. The province has 17 confirmed cases of infection. Our SABC reporter Yanga Funani is at the center. Let's go to him now.
Greetings, you are coming to us from East London at the Provincial Health Department offices, where the MEC for Health, Uma Musindiswa Komba, is about to tell us about the recent developments. We understand that the first case of a patient who has been admitted at the Livingston ICU, which is the official quarantine zone, has been admitted. But to tell us more about this, we have the MEC for Health, Uma Musindiswa Komba. Ma'am, please take us through what happened.
Well, we received a patient, a retired nurse, and at the time of getting to the hospital, she was in coma, so it was not easy to know exactly what was wrong with her. So all tests were run, including COVID, but then COVID-19 was found to be positive. What we are gladly able to report now is that she has been isolated in the ICU, but equally that there are signs that she's responding.
Okay. Have the people whom she associated herself with been traced?
Obviously, whenever we have a positive case, we do actually look for contacts. And definitely we put immediately some trace on those contacts.
Okay. We also made to understand that there has been a doctor at Doranginza and a nurse who have tested positive for this virus. Can you tell us more about that?
It is true. We do have a doctor who is in the enrollment of doctors in Doranginza who has tested positive. We, however, are having sketchy information around the source of him being positive. Equally, the nurse in Yotenek is a nurse in our employ, but she was part of a funeral that had people even outside the country. And then after that.
So there could be more cases out there?
Well, I'm not as you are, I'm not a prophet of doom, very much positive that in the cases that we followed in terms of contacts, we have been very lucky. We might even be lucky this time, but we are following up on all contacts.
So what sort of measures have you put in place to ensure that those who have tested positive, particularly in the health space, do not really infect other people?
You must recognize that we do not actually take everybody into hospitals. We isolate people where they actually choose their own voluntary isolation, precisely because their symptoms are mild, they're not sickly, so those are accepted. It is only those that we see as sickly that we bring into our facilities.
Ma'am, thank you very much for your time.
Thank you so much.
And that's MEC Komba, who is the health MEC in the province, telling us about these cases which have recently surfaced. She's telling us that they are curbing the spread of this virus and they're doing all in their power to ensure that no further infections are coming into play. As for us here in East London, it's back to you in studio.
All right, Yanga, thank you very much indeed for that report.